name is Dr. Barb Gordon. I had the pleasure of teaching your children this week in biochemical genetics. Thank you for sending them to governor's school. I think they learned a lot this week and even had some fun. They're going to tell you about some stuff we did this week.
During this week, I love drawing pedigree charts. I love how I got to see the family history and the bloodline of people. Sometimes it was difficult to make them because there's so many family members and kids, but my essay Ryan was always there to help me. It was also fun making pedigree charts for the stories and cases that Dr. Gordon presented, especially the ones with bizarre family history. Thank you.
This week during class, we developed the phenotypes and genotypes of our rebound baby by choosing either a dominant or recessive allele at random using popsicle sticks.
After combining each mom and dad allele, we determined their traits and constructed each rebound baby using marshmallows, toothpicks, thumbtacks, and pipe cleaners. After building each baby, we developed a backstory involving each child's history in relation to the mother and the father, and whether each trait they possessed was a dominant or recessive allele.
We extracted DNA from strawberries by crushing them up and then adding salt to neutralize the solution, isopropyl alcohol for precipitating the DNA, and soap for dissolving the nuclear membrane. At the end of the experiment, we could see the DNA floating in the solution.
After the strawberry DNA, we used a similar procedure using isopropyl and salt water to isolate our DNA.
Here you can see our DNA
In the solution.
The next day, we determined who kidnapped Missy Baker by looking at DNA from hair samples from two suspects' car. Missy had a deletion in the CFTR gene, which causes cystic fibrosis.
The sample with the deletion was a smaller DNA fragment and ran faster on the gel electrophoresis. Suspect B was a kidnapper.
We used PTC paper to determine if we were bitter tasters. Bitter tasters have one different base in the Tase2R38 when compared to non-tasters. We used an enzyme to cut at the different base in the Tase2R38 gene in tasters. People who were tasters had two bands because the gene was cut, while non-tasters had one larger band.
This week, we also experimented with CRISPR-Cas. CRISPR-Cas was used to remove the LAC-C gene from coli.
The colonies turned white when the LAC-C gene was successfully cut.
When colonies were blue, the LAC-C gene was still remaining because the LAC-C gene metabolizes xgal, which turns the colonies blue.
The blue color indicates that the LAC-C gene is functional and the needed protein is present.
On top of what we did this week, we also researched a genetic disorder. The genetic disorder we researched was Turner syndrome, which is a disorder that affects females. While healthy females may have two X chromosomes, females with Turner syndrome only have one healthy X and one that is completely or partially missing.
There is no inherent pattern in Turner syndrome. It is a completely random chromosomal deformity. The main features of Turner syndrome are normal development of reproductive organs, delayed puberty or no menstrual cycle whatsoever, a short stature, kidney malformation. Other body abnormalities are elbow deformities, webbed neck, like this person here, scoliosis, and increased number of moles on their body.
Fun facts is that Turner syndrome affects 1 in every 2,000 baby girls, and the average height is 4'8".
Morphin syndrome is a condition that happens by the skeletal change which causes a displacement of lenses of the eye and the tendency to have an aneurysm.
Morphine syndrome is inherited from one parent and is considered a autosomal dominant.
Morphine syndrome is caused by a mutation of the fibrillin 1 gene, also known as the FBN1 gene, which is on chromosome 15.
Main features of morphine syndrome include pain in the back, abnormal raised mouth, crowding of teeth, blurred vision, nearsightedness, bulging chest, sucked in chest, abnormal long fingers, tall, long, and skinny, and short torso.
2 facts about morphine syndrome. The most serious complication with morphine syndrome is a problem with the aorta, which is the largest artery in the human body. And lastly, years ago, when doctors did not know much about this syndrome, the life expectancy was very low. But now that doctors have an understanding, the life expectancy is in the high 70s. Thank you.
Fragile X syndrome is a genetic condition that causes a range of developmental problems such as learning disabilities, cognitive impairment, as well as social and behavioral problems.
Fragile X syndrome is an X-linked dominant condition, meaning that the mutated gene is one of the X chromosomes. Fragile X is on the messenger ribonucleoprotein 1, which is usually used for brain development. There is no specific treatment, but there is therapy available for those in need, and people with Fragile X syndrome have the life expectancy of an average person. Male carriers or female carriers may have anxiety, OCD, depression, and 20% have POF, and over 30% of males over the age of 50 have progressive intention tremor, Parkinsonian, and autonomic dysfunction.
Most males and half females with Fragile X syndrome have drastic physical features that become more prominent with age, such as a long, narrow face, large ears, prominent jaw and forehead, flat feet, and unusually flexible fingers.
A few fun facts are that Fragile X syndrome got its name because individuals with the disorder have a segment of their X chromosome that is broken or fragile.
James Pruden Martin and Julia Bell first described Fragile X syndrome in the year 1943.
Cystic fibrosis is an autosomal recessive disease. The condition is a mutation in the CFTR gene found on chromosome 7. The mutated gene causes salt to flow in and out of the cell differently. This creates a mucus, a perfect place for bacterial and fungal growth.
This mucus blocks airways and other passageways throughout the body. This can affect the respiratory system as well as the digestive and reproductive system. Symptoms include repeated coughs, repeated lung infection, and lack of weight gain. And to test for cystic fibrosis, doctors perform sweat tests as well as test for high levels of citric acid and citric phosphate. They also test for low fructose levels. Fun fact, cystic fibrosis is most common in white people with Northern European ancestry.
Neurofibromatosis is a condition that causes tumors to grow along the brain, spinal cord, and other nerve tissues. These tumors are oftentimes benign, but there is an off chance that they can become cancerous. Different versions of this disease exist, such as neurofibromatosis 1, neurofibromatosis 2, and schwannomatosis. Depending on the kind of neurofibromatosis you can have different symptoms, such as café au lait, bone deformities, bumps under the skin, ringing in the ears, poor balance, short stature, numbness in limbs, and chronic pain. But most of the time, you will have a normal life expectancy.
People with neurofibromatosis, the inheritance pattern is autosomal dominant, which means that you inherit it from your parents, but you only need one affected chromosome to get this disease. Because there are 3 different types of neurofibromatosis, there are different mutations in your genes that you can have. For type 1, it's the NF1 gene, which is located on chromosome 17. For the second type, it's on the NF2 gene, but that is on chromosome 22. For the third type of neurofibromatosis, it's called schwannomatosis, and there are 3 different types of mutations you can have, which is NF2, SMARCB1, or LZTR1 gene, and a loss of the 22nd chromosome. An interesting fact about neurofibromatosis is that NF1 is the most common neurological disorder caused by only one gene. So 1 out of 3,000 children can have this disease.
Down syndrome, or trisomy 21, is caused when a person has 3 copies of chromosome 21. Trisomy 21 is the most common cause for Down syndrome. There are 2 other reasons it can happen. Down syndrome is caused by an error in cell division.
Down syndrome can cause other diseases like leukemia and heart defects. There are 3 types of Down syndrome: trisomy 21, translocation, and mosaic, though like she said, trisomy 21 is the most common. 1 in 700 babies have Down syndrome, and there are over 400,000 people with Down syndrome in the U.S. The life expectancy for Down syndrome has increased by 50 years since the 1960s.
Some symptoms of Down syndrome include a small head, small hands and feet, upward slanting eyelids, and heart defects.
Some other symptoms are a flattened face, less muscle tone as a baby, palpebral fissures, and a protruding tongue.
Here I'm going to inform you about Wolff-Hirschhorn syndrome, which is a genetic disease that affects facial features and growth and development.
Wolff-Hirschhorn syndrome is an autosomal dominant disorder. In most cases, however, it is not inherited. This syndrome is due to chromosomal deletion. It occurs randomly in early embryonic development and is less predictable than most disorders.
Wolff-Hirschhorn syndrome is caused by a deletion of the NSD2 gene, which is in charge of appearance and developmental milestones, and the deletion of the LETM1 gene, which, when lost, is believed to cause seizures and abnormal electrical activity in the brain. And lastly, the NSX1 gene, which is associated with dental abnormalities and cleft lips. The more deletion, the worse condition for the patient. The genes are located on chromosome 4's short p arm, which can be written as 4p minus.
Main features of people affected with Wolff-Hirschhorn syndrome include a broad, flat nasal bridge and a high forehead. The eyes are widely spaced and there is a shortened distance between the nose and upper lip. Other characteristics include delayed physical and mental development. Many suffer from intellectual disabilities and weak communication skills. People with this disorder tend to have delayed motor skills and a shortened vertical structure. Additional features include skin changes, dental issues, and brain or heart abnormalities.
Some fun facts are that people believe that Wolff-Hirschhorn syndrome has to do with the appearance of a wolf or getting bitten by a wolf, but it actually has nothing to do with wolves. It is just named after the discoverers of the mutated chromosome, Kurt Hirschhorn and Hugh Wolff, in 1960.
Our disease is Angelman syndrome.
Angelman syndrome is an autosomal dominant disease inherited from the mother.
Angelman syndrome is deletion or mutation of the UBE3A gene on chromosome 15. People with Angelman syndrome are either missing a copy of the gene, a deletion, or a copy that does not work properly, a mutation.
Angelman syndrome is a genetic disorder causing developmental and nerve-related symptoms.
Main features of Angelman syndrome include developmental delay, absent speech, seizures, impaired coordination, and outbursts of laughter.
Just like they're doing right now.
Distinctive facial features, intellectual disabilities, happy demeanor, hyperactive behavior, a small head, bulged forehead, flattened back head, and bulging lower jaw.
Fun facts.
Angelman syndrome was once known as happy puppet syndrome.
People with Angelman syndrome live a close to normal lifespan, but there's no cure.
It affects an estimated 1 in 12,000 to 20,000 people.
I'd like to thank you on behalf of GoSciTech for sending your children here to GSSM to learn about the genome. taken because we all had a lot of fun and we all learned a lot.
We would like to thank our two wonderful essays. Anish, come here.
Yeah!
And Ryan, the twins. They did an absolutely fabulous job.
They certainly did.
We'd like to thank the Governor's School for letting us have camp here every summer. We'd like to thank all the sponsors that allow us to have the camp. And we'd also like to thank Susan Engelhardt for organizing the camp. We had a great time. Now what does everybody need to remember?
DNA!